My name's Gabrielle and this is Braxton, and I'm the granddaughter of Alf Jordan and this is his great-grandson.
The Caldwell family is missing their granddad Alf.
We knew he was unwell, but we certainly didn't expect it to be COVID, and we didn't expect COVID to take him so soon.
They weren't allowed to be by his side when he died last Friday, the first casualty of the coronavirus outbreak inside the Glendale Aged Care Home in southwest Melbourne.
The hardest part of this is that we weren't able to comfort him in his last moments, and also we weren't able to say goodbye. That's what hurts.
The aged care home is now on high alert, with the cluster growing to 15 today. 10 staff and 5 residents have now tested positive.
This is my room from my front door.
Fellow Glendale resident 46-year-old Nigel Hart says the news of Alf's passing has shaken the facility. Nigel has underlying conditions that require him to be in a care home.
When I heard about the 13 cases, I cried a few times that day because I will admit I'm scared. I miss seeing people. I miss seeing my friends.
Currently, there are 110 positive cases linked to residents and staff at 32 aged care facilities in Victoria. The biggest clusters are at Menarock Life Aged Care in Essendon, Glendale Aged Care in Werribee, and Estia Health in Ardea in Melbourne's northwest. Infectious disease expert Mary Louise McLaws fears clusters in aged care homes will grow, and she's worried lessons haven't been learnt from the deadly Newmarch House aged care outbreak in Sydney.
I don't think we've seen any success to control it within these facilities, even with nurses and doctors being employed to look after cases. These facilities aren't built for infections. They're built as a home, as a shared accommodation, not as a proxy hospital. The lesson that should be learned is that as soon as one of the residents is identified as being positive, they should be moved to a hospital. Not everybody in a nursing home or a residential aged care facility is at the end of their life. So we need to give them every chance to survive COVID.
Nigel Hart says while he has no complaints about the care, there's been a lack of information for residents and their family about the COVID situation.
The only way I've been finding out about the cases and everything is through the news.
My nan's name's Olivia Vick. She is the best ever, and last year she had dementia brought on quite suddenly, so we placed her into care in November of last year.
Tegan Burns is trying to move her grandmother Olivia out of Glendale as COVID cases grow.
We are really, really stressed about how it may affect Nan if it does get to it because of the dementia. Nan has progressed quite quickly down the spectrum. Cognitively, they deemed visits once a day essential.
The lockdown means daily visits with Olivia Vick's family have been banned, replaced with fortnightly Zoom calls.
The nurses seem really lovely, but I mean, no one cares for your loved ones the same way you do. So she doesn't look like our Nan right now because she doesn't get the TLC. We'd definitely love to be getting more updates, but I think it's really difficult with the number of people that are living there.
The family doesn't know when they'll be able to see the 86-year-old in person.
we're not confident that she may recognise us when we do get to see her again.
Glendale declined 730's request for an interview, but in a statement said that they're increasing communication with residents and family, now providing daily phone calls. The facility also said that while they would like to transfer COVID patients to hospital, this must be approved by Victorian health authorities on a case-by-case basis. While those inside the aged care home wait anxiously, the Cordwell family has a simple message for everyone else.
My grandfather all passed away from COVID-19. I want to leave you a message. Wash your hands, social distance, use sanitizer.
We don't want another family to go through this, what we've had to go through. And it seems to be that it's just sort of taking over at the moment, isn't it? And it's getting frightening. So if we all stick together and we all do the right things, then we can get through it.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.